Yeah, Elizabeth.
Oh, I hear a lot of moms say, well, there must be something wrong with me because when she came out or he came out, I didn't feel this overwhelming sense of love.
Right.
And so I often will try to normalize that as well.
Yes.
Because I kind of experienced that too. When I had my daughter and they said her that, I was like, ooh, that's interesting.
Yeah.
Ooh, and I remember the guy who did the delivery said, she's fine. Like that, you know. But I was
Right.
like, ooh.
Yeah, that was initial detachment. Like, who are you?
So they
Yeah.
feel like there's something wrong with them because they're supposed to feel
Mhm.
this rush of just euphoria right
Yeah.
after they have the baby.
You know, there are two myths that I think are fundamental in how women think about themselves as mothers and also can have tremendous repercussions for the attachment relationship. One of them is the maternal bonding that you speak about, which is this sense of an electromagnetic charge connection, you know, at the moment of delivery. I actually, in my book, you know, where I interviewed a lot of couples, one of the women said, you know, I expected this hallmark moment. You know, I expected the tears and the euphoria, and this baby came out, and I thought, okay, you know, and I didn't feel it. And immediately, as you said, she thought, oh my gosh, there's something terribly wrong with me. You know, I'm bad. I'm bad, because mothers, you know, are supposed to feel, oh my gosh, you know. And of course we know, depending on what kind of labor you have and delivery, and did you have an unplanned C-section, or maybe even all of the emotional intensity of this is going to affect, you know, how we feel at that moment of delivery. And so it's our task to be able, once again, to normalize, but also to be able to distinguish what's beyond the parameters of what feels normal to us as clinicians. The other one that I think is first and foremost and fundamental is the whole idea of the maternal instinct. And when I tell my patients there is no such thing as the maternal instinct, I get, oh, really? You know, there isn't. There's an instinct to nurture, there's an instinct to protect, but there is no such idea that once that baby comes out of the womb, we're supposed to know every nuance, every complexity, every cry, be able to decipher everything. There is no such thing. And what I like to, you know, talk about with, you know, with patients is the idea that this is an emerging relationship. And just like you didn't know, you know, everything there was to know about your partner, you know, and probably still learning things about your partner 8 years later or 6 years later, or, you know, didn't know what he liked, didn't know what he didn't like, didn't know how to push his buttons, what was going to get him going. It's the same thing with your baby. And how can you possibly know everything there is to know about someone when you've never even met them? And I think it's really important for us to be able to normalize that, because that is such an entrenched and ingrained myth and idea. And dads buy into it too, because I've seen this in my office. Baby starts crying, dad's holding the baby, everything is fine, baby starts crying, and in a split second, here, okay, you're the mom, you know what to do. I'm the dad. I don't know what to do, you know. So that experience has to be normalized for fathers as well, that you are just as capable of being sensitive and compassionate and tender and gentle and responsive to your infant. This is not a woman's domain, you know. But for many men, and also depending on their own attachment experiences, you know. Anything else? Because I just want to talk about one more thing before I kind of open up again to questions. But anything else that you hear in your own practices, or?
Just a lot of perfectionism and
yes.
things we're talking about with myths and how it should be or what
right.
should be doing.
How she should feel, how she should behave, how she should be. Right. All the shoulds. I should. I should. Yeah. Absolutely. Yeah, Elizabeth.
Oh, I'm sorry, Andrew, I don't know. Hi. But I understand there's been some research about perfectionism and personality characteristics
yes.
in postpartum depression.
Right.
And there is some sort of link between a perfectionistic type personality and prevalence or risk of developing postpartum depression. Is that true?
I think, yes, there are some actual personality characteristics. Perfectionism, how they perceive, locus of control. Am I responsible for everything? Is the outside world, how do I figure that out? And I think also the individual who tends to be more perfectionistic, okay, more compulsive about things, is also more likely to latch on to these myths. Because these myths are myths about perfectionism, and it doesn't exist. It is a myth. I mean, the idea of perfectionism, the perfect delivery, the perfect parent, the perfect mother, the perfect breastfeeding experience. Everything is perfect, And it's always fascinated me that when you talk to couples, they want to find the perfect stroller, the perfect crib, the perfect mattress, the perfect bumpers, right? But nobody ever talks about what they're experiencing as they're going through with the process, what they're experiencing emotionally, what they're experiencing psychologically. And when I teach my transition to parenthood class, which is a childbirth education class, couples are astounded that there's all this stuff that they never thought about, they never began to talk about, was always kind of assumed, lots of expectations. So it is fascinating how these things tend to play themselves out. I know I'm kind of looking at the clock here, and I'm recognizing that I've got about 5 more minutes, otherwise Emily's going to ring the gong. And that would scare me, so I don't want that to happen.
I'd bring it quietly.
Oh, thank you, though. Thank you. So sweet. That's why I love you. Emily mentioned to you that I do a lot of forensic work. And one of the things that I think is quite striking is pregnancy denial and how that looks. Because many of the cases that I'm asked to consult on for the defense, there has been a pregnancy denial, and that pregnancy denial has often been followed by an infanticide or a neonaticide. Or, generally with pregnancy denial, we actually see neonaticide, which is the taking of the life of the baby within 24 hours after birth. There are different ways in which women deny their pregnancies, and it doesn't always mean they're psychotic. And even in our, normal everyday practice working with women, there are ways in which women deny their pregnancy that have more to do with what they're experiencing as they move towards motherhood. One of the very common ways in which women experience denial is what we call affective denial. In other words, the woman acknowledges intellectually that she's pregnant, but experiences very few or almost none of the accompanying emotional and behavioral changes. So while we would hope and expect that as women move towards motherhood, there's not just a physical gestation that takes place during those 9 months, there's also a psychological gestation that takes place. And we were talking about that earlier, that when a mom gives birth to a premature baby, okay, the physical isn't quite there, and neither is the psychological piece, because just like it takes 9 months, to grow that infant, it also takes 9 months to grow that mom, emotionally and psychologically. And so in an affective denial, often what we see is she's not preparing for the baby. She's not going out and buying all that stuff we're talking about. She's not talking to anybody about the baby. She's not visualizing herself in the role of mother, which is one of the very important parts of the process as we move towards motherhood. Many of us have experienced that. We see ourselves. I can remember when I was pregnant with my daughter. I was visualizing, us shopping when she was 18. Now I visualize us not shopping. Bob, could I ask you a favor? Could I have $5 for this, $10 for that? So they don't fantasize. They don't talk to the fetus. They don't interact with the fetus. They don't acknowledge. They don't acknowledge. They don't alter their lifestyle in any way. They really don't make any concrete or emotional preparations for the arrival of a baby. And often, a lot of that, just from a therapeutic standpoint, has to do with their own ideas about motherhood and what it means to be coming to motherhood. And what have their models been? How have they come to construct these attachment ideas about what is a good mother? Then we have, and you know what is problematic about affective denial is that it can also have deleterious consequences because it may result in decreased prenatal care. The woman may not take as good care of herself, because it precludes her getting ready. And part of getting ready is good prenatal care, good mental health. And so all of that kind of gets ignored, and then there's a much more abrupt transition. It's kind of an emotionally, what I would describe as emotionally blunted experience. Okay? There's a blunting of sensitivity rather than a heightening, which is what we would like to see. The other kind of denial is what we call a pervasive denial, and this is the kind of denial that I often, is the kind of denial that I often see in many of the cases I work with. And in a pervasive denial, not only the emotional significance, but the very existence of the pregnancy is out of awareness. And there may have been like a glimpse somewhere along the way of conscious awareness, but then it recedes. It kind of gets segregated back there in the recesses of the mind. And so what ends up happening is that the physical manifestations of pregnancy are either absent or they're misinterpreted. And in these kinds of, this experience of pervasive denial, a woman may explain weight gain in a very different way. The cessation of menstruation, she might explain as undue stress. She was traveling. Other ways in which she may see it. She may misinterpret the flutters or the movement as intestinal disturbances or intestinal gas. Okay? When it comes to going into labor, most of these women are not aware that they've gone into labor. And anybody who's been in labor, you know when you're in labor. Okay? They don't know that they're in labor. They either think that they've got the stomach flu, they may think that they are getting their periods and are having severe cramps. They most often give birth in the bathroom by themselves. These are unassisted deliveries. And most often, and this is the just startling part of all of this, is that there are family members right outside the door in the next room who are totally unaware of what is going on in that bathroom. Okay? And the women who go through pervasive denial often experience it as a dissociative kind of experience. Okay? And sometimes that dissociative experience is accompanied by a brief psychotic episode, and that dissociation is sometimes broken by the cry of the baby. Okay? And in many cases, women do not even know, okay, without psychotic features, they don't know that they've given birth. They think that they feel something drop out of them. They think it's a blood clot. They've lost blood. They're in a dissociated state. They have no real knowledge of what's happening to them. Okay? And these are the babies that, sadly, we often see winding up in trash cans. Okay? These are the women who've had pervasive denial of their pregnancies. And then, of course, there's the psychotic denial. So that these are the pregnancies that are denied in a very delusional way. So, for example, a woman may experience her pregnancy as a tumor that needs to be excised, a cancer. Or she may think it's a blood clot. And in some extreme cases, may think it is an alien. Which frankly, I don't think that's so abnormal. Because I think it does kind of feel at times like an alien experience. Very out of body, out of control. But there's this kind of delusional way in which women identify their pregnancies. This was not really a psychotic denial. This woman, actually, that I'm thinking of, that I saw a couple of years ago in the emergency room, had given birth, but was in the midst of a postpartum psychosis and actually thought she had died in childbirth. And was sitting there, conversing with me, and feeling as though believing, not feeling as though, believing that she had died in childbirth. So there are these very, kind of striking and startling ways, and I kind of, I feel like somebody needs to tell a joke here to lighten the mood, because it really, this whole area of perinatal mental health is so expansive, and there are so many layers to it. It's a really complicated area, but I want to open it up for just a few minutes for questions, if you have any that I can answer for you.